Good morning everyone. I am Dr. Jyotika Gupta. I am a consultant family physician at Aster CMI Hospital, Bangalore. Today I will be speaking to you about hypertension in Indians. Hypertension is the most important risk factor for a chronic disease burden across the world. Globally, it accounts for about 10.2 million deaths, and Indians are more prone to hypertension and heart diseases because they are affected at a younger age group as compared to the Europeans and the Westerners. What is the prevalence in India? In India, about 13.8% men and 8.8% women in the age group of 15 to 45 approximately are suffering from hypertension currently. And in India, it translates to around 207 million individuals. This has been estimated approximately to 1.63 million deaths in India in the year 2016. So what are the determinants of hypertension in India especially? Age. We have seen the prevalence of hypertension in younger age group in Indians, and as age advances, the physiological changes in the arteries and blood vessels cause more hypertension. Salt intake. It has been noted in India we consume about 13.8 grams of salt per day, which is almost double the global average. A high salt consumption of more than 5 grams per day contributes to high BP and an increased risk of heart diseases. Next is obesity and overweight. Being overweight almost doubles the risk of being hypertensive, and being obese increases the risk by threefold in comparison to someone who's underweight or even a normal weight. Central or abdominal obesity and a high waist to hip ratio is a common observation in India, and it is completely correlating with the high prevalence of hypertension in India. Poor dietary habits. We Indians are now completely influenced by the Westerners, and the consumption of fruits and vegetables has gone down, and contradictorily, the Western influence of junk food, soft drinks has gone up. And this is an important contributory factor for hypertension, especially in younger individuals. And we all know diabetes goes hand in hand with hypertension, and India, being the diabetic capital of the world, has shown the increase of prevalence of hypertension also in India. Alcohol consumption and tobacco. About 20 to 25% of Indian population either chews tobacco or smokes tobacco in some or the other form. And this is definitely a risk of developing hypertension, of course at an early age, and the effects get prolonged. Stress. The more we talk about stress, the less it is. The incidence of hypertension is directly related to the periods of stress, whether it is a temporary stress or a permanent stress in one's life, which can be related to their work, their lifestyle, the economic burden, the social responsibilities. Everything contributes to the stress. Next, coming to dyslipidemia. High cholesterol and hypertension go hand in hand, with almost 20 to 30% of Indians having high cholesterol. They are directly at a risk of developing hypertension. Now coming to the lifestyle changes. Rapid urbanization, mechanization, everything is available at our fingertips. We don't need to move out, and we have converted our life into a sedentary life now. And this limited physical activity contributes to an increasing prevalence of hypertension in India among us Indians. So then what do we do to prevent it? So all the determinants that I mentioned just now, we have to go back in the reverse order. We have to lose the extra weight that we have accumulated. We have to change our lifestyle. From becoming sedentary, we have to go back to being active. Being active even for 30 minutes per day in the form of either walking, jogging, swimming, cycling, any form of dance, aerobic activity helps a lot. We have to limit our salt and fat intake. Keep a check on our blood sugars, as we know that high cholesterol, high blood sugars go hand in hand with developing hypertension. Quit smoking, reduce alcohol. And early screening for hypertension, preferably from the age of about say 20-25 years, it goes a long way in recognizing and picking up hypertension at an early point. In conclusion, hypertension due to poor detection, awareness and control has become a major public health concern in India. So it is important that we all be careful of our health and with regard especially to our diet and lifestyle. Today let's talk about what is the relation between salt and hypertension. Indians consume almost double the recommended intake of salt as compared to the rest of the world. That comes to about 10.9 grams per day, whereas the ideal recommendation is about 2 grams per day, and the upper limit being 5 grams per day for an Indian diet. So how are they related? What does salt do? Salt intake on blood pressure is termed as salt sensitivity or the resistance. Because of this, because of the high sodium content, the table salt on intake, it expands the extracellular blood volume, and that retains more of water. It increases the cardiac output, and hence the blood pressure increases. Along with that, it also puts a stress on the kidneys, and the kidneys, they excrete more water, retain the sodium, and thus the blood pressure rises. So this is the way salt, that is the table salt or the common salt, pushes the blood pressure up. So then what do we do with the Indian diet? Our Indian diet is very famous for these pickles, chutneys, which are high in salt. And why are they high in salt? Initially it was a way of preserving the food, but nowadays it has also transformed into these packaged snacks like namkeen, matri, sev, chips, which are readily available, and they are packaged food and they are high in salt. Consumption of these kind of food, it has a higher impact on the hypertension in Indians. So then, but we've been using salt since ages, so then what's the difference? The difference is that nowadays we used more of refined salt, more of processed salt, which is devoid of all the nutrients, and it only contains the sodium, which is causing retention of water and causing high blood pressure. So then how do we reduce the salt, and what does it actually help us with? When we reduce salt in our food, when we reduce the packaged food, when we reduce the pickles, papad, chutneys, the automatic consumption of processed food goes down, and we will shift to having healthier food like fruits, vegetables, fresh food items. And that is where it has shown, studies have been carried out wherein they have shown a comparison between a normal diet and a DASH diet. What is a DASH diet? It is a dietary adjustment for salt restriction in hypertension. So when this diet, it contains more of low fat and high in fruits and vegetables, and this diet is known to contradict, or rather it kind of neutralizes our higher salt intake, and that's when it brings down the blood pressure. Many studies have been done which has shown that in comparison to a controlled diet and a DASH diet, the reduction in blood pressure is almost 3 to 4 millimeter of mercury for the diastolic and about 7 to 8 millimeter of mercury in the systolic. Yeah. So how do we go about this? We have to completely change our lifestyle. We have to change our diet habits. In a nutshell, what I want to say is, it is okay to savory and have these kind of dishes on an occasional basis, but not on a regular basis. So how do we replace these items? Let us replace it with fresh fruits and vegetables. When we have any of these nuts, seeds, let us not have salted ones. And any amount of salt which is added on top, that is when we sprinkle salt on our salads, on our food, that is what causes maximum harm. And when we choose our salt, let us choose the low sodium salt. I would like to repeat that the per day upper limit of consuming salt is about 5 grams, but ideally we should keep it restricted to about 2 to 2.5 grams per day. This is even lesser, much lesser than the global average. So once we keep a watch on our salt intake, it will help in a long way in maintaining the hypertension. Thank you.